I want to tell that I'm an occupational therapist and I'm working in kids care, Raipur. First we'll start with the way your brain is organized. How your brain is organized. Like we have two hemispheres of our brain. First is left and then right one. Okay. So, okay, it's fine. So when we talk about the hemisphere, our left hemisphere controls our right hand. Okay. And the right hemisphere controls the left one. So it goes by the your axis and your plane of your body. Okay. So it divides from your belly button. Okay. Ma'am, can you please share the image of that uh, axis and plane one? Yeah. So here everybody can see that there is a human, and it's divided with the axis and this plane. Okay, so it connects with our belly button. So it decides our midline. So firstly, when the child develop by the 9 month, they start clapping, right? Or they take something towards their mouth. So here they initiate their midline. Okay, they integrates their midline. So this start with our 9 month. Okay, then which hand controls and which hemispheres which. So ma'am, please share the slide. No,
the previous one, Charu.
Yeah, previous. Yeah. So our left hand controls writing, language. Left hemisphere control writing, language, scientific skill, mathematics, list, and logic. And left hand, like our right hemisphere, which controls the left hand, that controls emotional expression, spatial awareness, music, creativity, imagination, and dimension. Okay, so that's why we are able to write with the right hand, because our left hemisphere controls the right hand, and the left hemisphere controls the writing, language, scientific skills, etc. So when a child with autism comes to you and they lack firstly with the language, okay, or with the other things, like writing, they have so much problem with the writing skills. They have so many problems with their spatial awareness, with their body awareness. Okay, so when a child enters with the ADHD, autism, they always have problem with their left hemisphere. That's why they suffer with all these writing, languages, etc. And they are very good at their right hemisphere work, which is handled by like your left hand. So they are very good at imaginations, and sometimes they are very good at their skills with other things like art, craft, whatever they want, like wherever their interest falls. Okay, so next slide, please. Yeah. Okay. So now people come with the questions that when the child hand dominance, they can judge their hand dominance. So firstly, I want to say that there is first hand preference. Like when the child start developing, you don't give everything with their midline. No, you don't give it like, okay, keep it. You keep it on the table and you ask, okay, take it up. No, you give it on their hand. Okay, so the midline uh, initiation get disturbed. So whenever you will keep something on the table, so you can check whether the child prefers it from the left hand, to take it up with the left hand, or to take it up with the right hand. Okay, so basically your after the midline is developed, like you're clapping, taking up something and taking towards the mouth, or touching your head, touching your body, whatever it is. So first hand dominance emerges at the 14 month after the midline. Okay, so midline develops at 9 months, and then it develops in the 14 months till the 3 years of age or 4 years of age. Maximum with the left-handed dominance, it developed till the 5 years. Okay, so when it comes to the 14 months to the 3 years, child basically develops their hand preference, not the hand dominance, but hand dominance emerges till that. Okay, next point, please. Okay, children settle their hand preference with the fine motors and gross motor till the age of maximum 5 years. And next point, it takes more than it takes more than 5 years or 4 years for the child who are left-handed to develop their dominance preference. Okay, so मतलब अपना dominant hand कौन सा है, preference hand कौन सा है, हम लोग को decide करने में थोड़ा सा टाइम लगता है. And when it comes to fine motor and gross motor, sometimes what happens is left-handed people also use their right hand for the gross motor activities. Okay, next slide, please. Okay, so here come with the development of grasp. So when the child turn with the 5 months, so they develop their whole hand closure. Whole hand closure means this, like when the baby start holding your finger like this, that is called the whole hand closure. Okay, next. Okay, then the active thumb movement. So when the child starting their thumb moving actively like this or holding like this, okay, then next. Then they develop the palmar grasp at the age of 8 months. Okay, so palmar grasp is this. When their palmar reflex get integrated and the child is able to use their palmar for the grasping, so they start first with this, like with the fist. Yeah, they tries to hold their, sorry, whoever the asked the question, I'm answering that. So a newborn baby also tries to hold your finger because their reflex get integrated by that age. Okay, so it's from the stage when the child is inside the womb, and then when they come out, and also they develop that reflexes. Okay, so, but the proper, they develop the palmar grasp by the age of 8 months. Okay. Then they start the beginning of the fingertip grasp by the age of 9 months. Okay. So by the 9 months, they can use their tip, like um, to pinch out the pulses or to take something from the floor with their pinch. Okay, so they start, while they start crawling and they tries to pick. So first they try to pick it with their palmar grasp. They take their whole grasps to hold any of the toy or the ball, and then they start to pick the things by the age of 9 months. Next. Then they develop scissor grasp with the age of 9 months. They tries to hold the scissor and they know the torque of moving it, like open, close. These things they start by the 9 months. Next, please. Then they develop pincer grasps. Now, pincer grasps they develop by the 12 months, and it includes a lot of things like sprinkling the salt on a food, or like playing with a dough, playing with a spinner. These all grasp developed by the 12 months. Next, please. Okay, so by the time it comes to the tips, so first I want to tell you everything with that. When the child start writing, so we prefer that the child should write with the right hand. Okay, they should prefer with the right hand. You should know that the child, as you are awareness by your body, the child is also aware by their body. Okay, so let them prefer their hand first, then tries to guide them with your preference. Not, I should not say the preference, with the dominance hand, because there is a myth that the child who are left-handed have learning disabilities or are suffering with some development issues and all. Okay, that's true, that the child who are suffering with the neurological disorders, or autism or ADHD or learning disability, they have problem with the right hand dominance. But in general also sometimes it comes from your genetics. Okay, so like the father is left-handed, or the mother is left-handed, or the grandfather is the left-handed. So sometimes it happens the child start writing with the left hand, or the dominance is the with the left hand. So for the tips, I start with that: make sure your child is sitting on the end of the row. When the child hand dominance is left, at that time you can help your child to sit at the end of the row, and to the left of the another student. Okay, never make them, it's for the school setups or the tuition setups, he never make them to sit on the right side, because it will make they will struggle with the right-handed children to sit in a school with the same bench. Okay, next. Child should have more space on the left hand of the table to rest their arm. Okay, so leaves little space towards the left hand, and give them space to use their left hand, so that they can put their wrist on their left hand support, and they can get a proper support and proper alignment to write. Okay, next. Okay, so you need to notice your child grip also while writing. So I would like to tell everyone that when we start writing, no, so what right-handed people do, is there uh, is there no one? Okay, I'll take the question afterwards. Okay, so sorry. So when you start with that, okay, so when it comes to the writing grip, so the child who are left-handed, right-handed, they pulls the pen towards the paper. Okay, when you everybody try writing. When you write, you pulls it. Okay, and what happens with the left-handed? They try to push it towards the paper. So it makes very difficult for them to write it with the proper pressure. So what happens sometimes when you will try writing with your left hand, your
Dr. Charu, sorry, will you be able to show us that on a book and paper? So
yeah, I'll do that.
It will be easy for us to understand. Thank
Yeah.
you so much, Dr. Charu.
Please switch with the video. I'll do that. And okay, so if this is the paper, it is visible.
Yes, it is. It is, Dr. Charu.
So when like I am right-handed, okay. So this is the paper, and if I write something like I'm writing Charu, okay. So look at the grip. I'm writing with the tip, okay. So most of the right-handed, everybody can try this. Like I am writing my name here, okay. So I'm pulling it, like हम जैसे उठा के लिखते हैं ना ऐसे, we are pulling it. Okay, and what left-handed people do is they write, wait, they write with the left hand. Okay, so what they do, they handle the pen uh, like from 1 inch above the tip. Okay, and they push it for making a proper pressure. Okay, everybody can like I am right-handed, so I'm able to write it, but so they put it like this. Okay, and so that they can make the writing darker. So what we do is our pen is like on the slanting one. Okay, थोड़ा सा tilt हो जाता है और हम लोग का point और grip proper हो जाता है, but they need to put the pressure to make the tip proper. Okay, so this is the thing that they push it towards the paper. So what happened, it's very fatigue for them to write too long. Okay, so you need to notice whether if your child had started writing with the like 1 inch above or 1.5 inch above the paper, so they will write it like this, or and also they will use their whole 4 fingers or 3 fingers to write their name on whatever they want to write. And with the right hand, we only use our, like I told, the pincer grasp. We use only two, like our thumb and our index finger, and the middle finger to balance the pen. Okay, so this grip we follow. Okay, this is the general grip everybody does, and sometimes it happens that everybody have their own style of writing, so that differs. But when you will come to the gripping of the pencil, so it always like they grip it a little above than the tip. Okay, so and make sure that they like they make their wrist straight, so that the pen get, like if you will write like this, so your pen will get tilted automatically, right? And if you will write with the point, so with the proper straight wrist on the table, so it will be more convenient for the child to write without tilting their copies and without tilting their books. Okay, next please. Okay. Make sure that that your child's hand is below the line of their writing, so they can see what they're doing. Okay, so basically why the left-handed prefer their gripping above the inch of the pen is that, tip of the pen, sorry, so that they can see what they are writing. Otherwise they will hide what is the written, what is already written on the copy. Okay, so like if there is something written here, okay, and then I'll try
Dr.
to
Charu, sorry, you're off the screen. We can, yeah, if you can shift bit to your right, and
yes,
then we can see what you're showing.
is it okay?
Yeah, try showing the demo again with your left hand.
So, okay, so like if I am writing with the right hand, so I need not to like tilt my paper, and I can write like this. Okay, so like I can write like this. Okay, so it's my right hand is not hiding what I am writing, but the child faces problem with the left hand is whatever the thing is written above that, they will hide it with their hand. So that's why they prefer to write like this, like leaving the tip and holding 1 inch above the pen. Okay, so they tries to write like this. That's why what happens sometimes the grasp, because of the gripping and grasping above the tip level, they are unable to write it darker. Okay, so this is the problem they face. So one thing we can do for these kids, that we can tilt their paper. Okay, so what we do, we write it vertically, right? हम कॉपी कैसे रखते हैं, हम लोग vertically रखते हैं and we keep on writing, right? But if you will tilt them horizontally, so it will help the child to write it. Okay, ma'am, I have shared one video of making the 8 of the child with the left hand. Can you please share it? Okay, I'll let you know which one. You're not audible. You're on mute, I guess.
Is it the midline crossing and tips?
Yeah. That one.
Okay, I'll just share that. Midline crossing and tips, right?
Yes.
Just give me a second and I'll share it. This one, right, Dr. Charu?
Yeah. Okay, so here you can see how the child is holding the tip so that he don't hide it, right?
Right. Makes sense. Like,
yeah. Please check
okay.
it. Yeah. So look how the child. And one more thing. Can you play one more video was there with this?
Sure.
Yeah.
The other one, right?
Yeah, other one.
That's again tips, right, Charu?
Yeah.
Okay.
So I asked the child to make left-handed child to make a lazy 8. So when I gave him the copy horizontally, so he was unable to do that because it will hide the child what he is making. So making a lazy 8 was difficult for the child. So look what he's doing. He's making a simple 8 and holding it above the tip. of the pen. Okay, so look at the inches, how much inch difference we use to write with the tip of the pen and how much he is using with the tip of the pen. So like I didn't allow him to move. I asked him to maintain a proper alignment and writing with the horizontally. Then please play the next video of the same.
Do you want me to show the same video again, right?
Yeah.
Right. The contrast makes, like, now we can see what you're trying to say.
Yes. So that was the first video. I asked the child to write and I gave the copy like I wanted him to write. Okay, so I gave him horizontally to make lazy 8 pattern like this, and I asked to continue it with the same like this. Okay, so what happened with the next video, I asked him to make that the same pattern and I put the dot. Okay, so I put 3 dots and I asked him to connect like with the 8. So he was able to make the lazy 8 pattern. But what happened that again, like he was holding with the tip, so he was hiding it. But when he tried to write with the inch above, so he was able to successfully make the lazy 8 pattern. Okay, like this. I asked him, and then he shifted himself because I didn't allow his copy to move. So he tilted like this. Like you can see in the video, कि वो थोड़ा सा bend, right side bend, okay, and he tried to make the 8 pattern. So allow your child to tilt the copy. अगर left वाला लिखेगा तो he will put the like if we are writing in a vertical way. Okay, so what will like हम वर्टिकल वे में ही कॉपी को रखते हैं लाइक दिस एंड वी स्टार्ट राइटिंग. ओके, बट व्हाट हैपन विद दैट चाइल्ड, इफ यू वांट हिम टू राइट विद वर्टिकल पैटर्न, they will shift it to horizontally and they will start writing vertically. Okay, this happened with the left-handed child. Okay, so next point please. Any queries with that?
So participants, use the chat box if you have any queries on this, and or else we can move to the further part. Okay, so what I'll do, Charu?
Somebody want to repeat. Okay, my daughter is a right-handed person, yet she slightly tilts her copy. Is that normal? Yeah, it's absolutely normal. But if you will give your child a space to keep their wrist and with the proper alignment, so she will not shift the copy. Okay.
You want me to go back to the slides now, right?
Okay. So,
Dr. Charu, this is what you mean by make sure your child's hand is below the line of their writing. And
okay, so sometimes like I told you that they hide doing that, no? Like अगर वो कुछ लिख रहे हैं and उन लोग left handed हैं, so उनका जो hand है वो लोग tilt करके लिखते हैं. So what they do, they hide the line above and below or the copy. So उन लोग का जो proper डिस्टेंस है राइटिंग के बीच में या 2 लेटर्स के बीच में और 2 वर्ड्स के बीच में, वो प्रॉपर नहीं रहता है. सो दैट्स व्हाई उनको लाइन बार बार चेक करनी पड़ती है. लाइक they take their hand off and they again see, and then they take their hand off and again they see that. So before giving them a lining sheet, ask them to practice on the plain paper without line, so they can develop a habit to write like not in an aeroplane manner. उन लोग की handwriting ऊपर चली जाती है, aeroplane जैसी हो जाती है. So they can practice on a plain paper, तो उन लोग एक सही लाइन पे लिखें. पढ़ने की जरूरत नहीं हो तो हम यूज करबे करी.
Right, so that's a valid tip that for left-handers, once we are making them write, use a plain paper so that they don't have to worry about
yes,
the right lines. Okay.
Yes.
Richa, can you go on mute? Yeah, I've muted her. Okay. Next,
okay. Yeah. Next. So for the left-handed people, it is difficult to put in the finger spaces between the words, right? Like I told now. So you can ask them to imagine O between each of the words so that they can maintain the distance. Unko उनको स्पेशियल अवेयरनेस रहती है, बट व्हेन दे कम्स टू राइटिंग तो उनको वो अवेयरनेस थोड़ी कम हो जाती है. दे डोंट डिस्क्रिमिनेट between the spaces and between the figures, and so उनकी हैंडराइटिंग भी शुरू में थोड़ी ओकेश रहती है, मतलब they are not very good at their handwriting. After a long practice they develop a good handwriting. So next. Okay, so whenever child go to school and they are not able to use the right hand scissors in their craft classes or any other thing, so always prefer left handed scissors for the left handed child. Otherwise they will struggle with their, so before that you need to know the dominance and the preference difference between the child, whether they are preferring it or their dominance is asking for that. Okay, next. Okay, so when it comes to mark making skills, so when mark making skill will help your child always, uh, because आप उनको उनके ग्रिपिंग स्टाइल पे उनके ग्रास्पिंग के लिए आप दे कैन हेल्प, ओके यू कैन हेल्प देम. तो मार्क मेकिंग स्किल्स कम्स विथ हैंड ओवर हैंड, मतलब आप अपने हाथ के उनके हाथ के ऊपर हाथ रख के उनको पहले डॉट्स पे समझाइए, देन यू कैन कंटिन्यू. ओके, क्योंकि उन लोग की हैंड राइटिंग डिस्टर्ब रहती है बिकॉज ऑफ द प्लेन एंड द अलाइनमेंट विच आर डिस्टर्ब. Okay, for matching dots to dots, like I gave that child is in class 3 I guess, and even though he was struggling with matching the dots with dots, though like they hide their dots too, so make them practice dots to dots. And like you can use the sand skills, so making alphabets on the sand with the left hand, so it will help your child to progress with their handwriting with the left hand. Okay, so you can give them a simple maze pattern, maze activity, to follow the direction and follow the left or right marks on the sheets for the maze activity. Okay, then you can it will help. Mark making activities generally help with the tracing. Okay, so they can trace. Okay, and then you can give them scribble and doodle pictures. Okay, so like you can ask them to make hairs or the clouds on the paper sheet with their left hand, so it will help on the mark making activity. Okay, next. Okay, choosing the writing tools. Can I be writing? Okay, I'll come to that point and I'll answer that question. Okay, choosing the writing tools. Okay, so sometimes children with the left-handed, as I told, that they struggle with the gripping. They grip above the 1 inch of the pen or the pencil. So you can use a correct writing tool. Like there are so many tools present in the market. I can name like, okay, like Stabilo Easy Move or the Euro Move. Okay, so these are the writing tools which help the child for the gripping. If they have muscle control problem also with the gripping, I'm including here with the autism case also. Like the children with autism also suffer with the gripping, so you can use the like you can choose the correct writing tools, and your occupational therapist and special educator will definitely guide with you with this. Okay, next point. Okay, so the pencil grip aid. So in the market there are so many pencil grip aid you can use for your child, like ultra grip, gross grip, or stereo grip, etc. Next point. Okay, now the mirror writing. Mirror writing, usually this tip we use with the learning disability children, the children who have learning disability and they are unable to copy it from the blackboard. What happened is, like when it comes to our vision, we form a, please can you share my video? Yeah. So we form a star like this. Okay. Sorry, I'll make it and I'll show it. So we make a star. Okay. So here is our brain. Fine. Is it visible? This point is our brain, and this is our left side, and this is our right side. This is our left side, and this is our right side. Wait, I'll show. Okay. So if the child is right-handed, so what our brain makes the vision is towards the left side. Okay. And if the child is with the left-handed, it makes the proper vision with the right side. Okay. So it goes vice versa. So then when you write on the blackboard, so child with the left-handed, what they are writing like this. Okay, they'll tilt their body or they'll tilt their paper. So they need to move their head towards the blackboard. And what the right-handed children do, they just look at the midline and they can write it down. Okay. So this is what I wanted to explain, that it makes a star. This is our brain. Our right side will always look at the left side because of the hemisphere I told you. Okay. So like this they need to. So if we start writing with the left side. Yeah. So the children with the left-handed is writing like this. Okay. So they need to tilt their head. So sometimes what happens with the children who are normal sometimes suffer with the learning disability, or they are considered that they have learning disability even though they don't have, because of the vision or the focal is divided. Because of that the children suffer with the learning disabilities. I should not say they suffer, but they struggle with that. Okay.
It's
So
more like looks like an acquired learning disability.
yes,
They don't
yes.
have it, but looks like it's an acquired one.
Yes.
Get that, Dr. Charu.
For them also we can use mirror writing concept. Okay. So जैसे हम लेफ्ट से शुरू करते हैं, तो हमेशा क्या होता है कि ओके जस्ट सेकंड ना पानी। तो हमेशा क्या होता है कि उनको कभी कभार लेटर्स जो है हम सिंपल पी सिंपल बी फॉर्म कर रहे हैं, एंड दिस स्ट्रगल कॉपीइंग इट है और वो उल्टा कॉपी करने लगते हैं. तो यू कैन यूज दिस मिरर राइटिंग कॉन्सेप्ट to train your normal child also. It's not only for the autistic child or the thank you this is it's not the only case with the autism child or the children with learning disability. So normal children also struggle. ठीक है, लेफ्ट हैंड वाले नॉर्मल बच्चे भी स्ट्रगल करते हैं. लाइक द वीडियो आई शेयर्ड इज अ नॉर्मल डेवलप्ड चाइल्ड विद द लेफ्ट हैंडेड, एंड आई आस्क्ड हिम कि आपको ब्लैक बोर्ड से कॉपी करने में डिफिकल्टी होती है, एंड ही सेड yeah ma'am hoti hai because I need to move, I need to tilt my copy and I'm not as faster as them who writes there. So what happened कि उन लोग के साथ क्या होता है कि उन लोग जब टिल्ट नहीं कर पाते हैं, उन लोग स्लो हो जाते हैं लिखने में, उन लोग को कॉपी करने में डिफिकल्टी होती है. तो दीज आर द प्रॉब्लम दे फेस. इवन द नॉर्मल चाइल्ड ही सेड कि मुझे ना थोड़ा सा या तो तिरछा देखना पड़ता है, आई नीड टू यूज माय पेरिफेरल व्यू मोर देन द सेंट्रल विजन बिकॉज मुझे मतलब सब लेफ्ट से लिखता है एंड आई एम लेफ्टी, तो मुझे ऐसे पूरा टिल्ट करना पड़ता है. तो इवन दे स्ट्रगल. सो लाइक ही सेड कि मुझे फिर चश्मा लगाना पड़ा उसके लिए बिकॉज अगेन एंड अगेन मूविंग दैट लाइक muscle a lot, so they struggle. Okay, so next please. Yeah. So okay, so to correct left hand writing habits, you can do is like one question was also there. So if you're lefty, so it's okay to be a lefty. Okay, it's just you need to train yourself a lot. And if you want your child to be a righty, even if the dominance is left hand, so it's not a good decision. Like from my view, it's not a good decision. And if you want them, so you can take a 3 weeks, like बहुत regular रहना पड़ेगा, and don't allow them to write with the left hand, and make sure that in school also they write with the right hand only, and make practice of the grasp, gripping with the right hand a lot, so that they can move to right hand. Generally the parents who is growing their children with autism, sorry, so they also always force the child to write with the right hand. It's fine to be a left. Okay, next.
So Dr. Charu, I had a question here. So what you're trying to say is a child, if he is naturally left-handed,
Yes.
we should not try to force him to become a right-handed one.
Yes, definitely, because they too have their, like everybody have their flaws and good things in themselves. Okay, so there is nothing wrong to be a left hand. So you can you never do that to switch your naturally left-handed child to, because sometimes it's genetic. So don't push them to write with the right hand because of the myths that उन लोग फिर बड़े होके learning disability struggle करते हैं और उन लोग को ये प्रॉब्लम होती है, but everything we have a solution. Okay, for every problem with the left-handed we have a solution. We have special educators who train them very nicely to be left-handed, and we have so many tips and tricks to train them. Okay, even though if the child is right-handed, we guide them to write ना, उन लोग पैदा होते ही लिखने तो नहीं लगते हैं. So every child needs to get trained to write. Okay, so it's okay to be a left hand. Okay, yeah. Okay, so for this like I have added suggestion for the autism, like I told for mark routines, mark making, that you can do hand over hand. Okay, so with the autism kids, the problem is we can't go for hand over hands. Now the question is why we can not go hand over hand for the autism kids, because they have habit to learn from their routines. Okay, so अगर आप आदत डालेंगे कि हैंड के साथ वो लिख रहे हैं, आप अपने हाथ से उनको हाथ पे से लिख रहे हैं, तो उनको रेक्टिफाई करने में या उनके प्रॉम्प्ट्स को फेड करने में इट विल टेक अ लॉन्ग टाइम. ठीक है, तो आप उनको हैंड ओवर हैंड मत दीजिए. You simply put a dots, and if they are struggling with the writing, show them the picture, because they learn visually. Because as I told ki, their their right hemisphere is so active, so that they use their left hand. So उन लोग picture से भी समझेंगे. Use some other tricks. उनको आप सैंड में लिखना सिखाइए. You use shaving foam को रब कर दीजिए और उसके ऊपर you make them write. ठीक है, don't use hand over hand with a pencil grip, otherwise they will leave. वो pencil आप ही के पे छोड़ देंगे, you will write and the child will not write. Okay, okay, next point. Okay, so next is don't like they children with autism always struggle with the initiation. So now how they struggle with the initiation, like they are very poor at the executing like for executing the functional skills. like उनको यही नहीं समझ आता कहाँ से स्टार्ट करना है, कहाँ से स्टॉप करना है, कहाँ पे like कब एक्टिविटी स्टार्ट हो गई, कब एक्टिविटी फिनिश हो गई, व्हाट इज द नेक्स्ट स्टेप टू डू दैट. तो अगर आप हैंड ओवर हैंड उनको हेल्प करेंगे तो दे विल लिव इट ऑन यू कि लाइक आप ही लिखो, यू इनिशिएट. आप फिर क्या होगा ना कि जब तक आप उनके हाथ के ऊपर ऐसे पेंसिल दे नहीं देंगे, पेन दे नहीं देंगे, they will not start writing, they will not start initiating. Okay, so again you can do you can use the dot pattern. Pattern is the easiest and simplest and the most preferable pattern a child can trace. Okay, if the child is not able to write with the 2 or 3 dot, increase the dots, make the size, increase the dot sizes. Okay, so that will help the child to learn visually. Okay, make the autism child learn visually a lot. So because they are more towards the visual. Okay, they learn from visual, so it's fine if you not help them writing with the hand over hand, आप कर सकते हैं hand over hand, but prefer not to do that. Okay, next. Okay, so they have right to control their own bodies, right? उन लोग की like we force most of the autism children to write as per we want, as per like जो हम prefer करना चाहते हैं, we force them to do. So never do that, क्योंकि उनको भी पता है what their body want, how their body works. ठीक है, अगर like if I say that today I don't want to wash utensils, and you will make my hand, you will like grab me and you will say, snatch everything, and you will say, you know, go and wash your utensils, and you will take my hand and put the like dishes to wash it. So even I would not like to do that, right? आप मुझसे जबरदस्ती करा रहे हो, so don't do that. Don't make your child to prefer your right hand only, और आप उनसे जबरदस्ती writing करा रहे हैं. Okay, make the things interesting for them. Like आप कलरफुल चीजें यूज कर सकते हो, आप उनके टॉयज यूज कर सकते हो उनसे राइटिंग कराने में. ओके, नेक्स्ट प्लीज. Okay, never force your child for writing. Okay, if they are communicating well, अगर उनका writing में बहुत ज्यादा interest नहीं है and they write slow, तो बहुत ज्यादा force नहीं करिए. Make them to practice again and again. Okay, practice makes men perfect. So make them practice. Don't push them, you know, you have to write, you have to make a routine, otherwise as they follow the routine you will unable to fade it out. Okay, then they will make pattern कि मैं यही लिखूंगा, I'll write this only. Then they will get stubborn कि नहीं मुझे यही लिखना है because I have a habit of writing, और या ये मेरा writing time, I have to do that only, I'll not go out or I'll not go to some party or social or public areas because this is my writing time and I'll write. तो उनका रूटीन बना के डोंट फोर्स देम कि आपको इस टाइम बैठ के लिखना ही है. ओके, मेक द थिंग्स इंटरेस्टिंग फॉर देम. ओके, नेक्स्ट. ओके, so incorporating with OTs, ठीक है, OT के techniques I'll share, and the things we miss generally, so I'll share these things. Okay, so as I told, the very much important thing in this is by bilateral integration and crossing. Bilateral integration and sequence. Okay, so this is also called BIS, and that means both of the sides of the hand, like both the hands and brain communicates equally and perfectly or not. Okay, so when we come to the bilateral integration of the child, we can use this on the normal children also. These tips are for everyone, and this is exclusively for the like autism children who have habit of writing with the left hand and other things. Okay, one you want, if you want to shift it, so you need to know whether it is the preference or the dominance. So as I told that the preference is till the 5 years of age, and then after that they come to the dominance of the hand. So till that you can work on your child. Okay, so you can work on your child with the midline. Okay, like I told that they start initiating, yeah, they integrate their midline at the age of 9 months. Like they start first time when the child with the normal development start clapping their hands with each and every sound or each and every activity, like okay, wow, so they start clapping na, kuch bhi naya dekhte hain to they start clapping. So this is our midline, ye hamari midline hai. Okay, so they initiated the midline. After the 9 months they start crossing it. Okay, like if they want to scratch their elbow, they will do this, they can use their cross line. Okay, crossing, midline crossing. So when your main hand goes to the opposite and the other do the same, so this is our midline crossing. Generally the brain gym exercises proves this. Okay, that midline crossing is important, and definitely all the special educators will help you with the brain gym exercises, which are important for the children for developing midline crossing for their all the ADLs. ADL includes everything like grooming, eating, writing, and I should say that the writing is the most difficult ADL for every one of us. Okay, so for that midline crossing is really important, and like at the age of 3 years, they develop the midline crossing very normally. मतलब बहुत अच्छे से they develop in 3 years of age. Okay, so next midline orientation appear भी हो गया.
Dr.
Midline
Charu,
crossing
sorry,
भी
you
आ
want me to
गया.
show that video on midline crossing so we get an idea what you're talking about?
Please do that. Yeah. And it's a general video, like I have captured it like when I was taking a session, so it's just a general video. Okay, yeah, this is the bilateral one. Can you show the another one?
And Dr. Charu, quickly, it's 6:50, so just wanted to give you a heads up that
Okay.
I understand even I'm finding it so gripping and I have so many questions in my mind to, shoot right after
Okay,
you're done.
I'll finish it fast so that we can take the question. Okay, so this is the video. The child is balancing on a balance beam, and he's putting it with the cross hand. Okay, so this is the midline crossing video. Okay,
I'll show the other one also that.
Yeah.
Because I found the videos very interesting when you shared it. So I thought, our participants should also see. It's a very nice midline video.
So this is the anti-gravity. Okay, so how the child perform with the anti-gravity, being performing in a anti-gravity is also very important, because it will make the child more oriented, more aware about the body. Okay, so midline crossing in anti-gravity position is equally important. Okay, so जब भी आप like I told ना कि हम लोग ऐसे कभी blackboard में भी लिखते हैं, तो blackboard is not on the gravity position. So the child need to develop. Yeah, writing on a blackboard is not an anti-gravity. Okay, it's it's like with the base, no. So जब हम ऐसे table पे जब लिखते हैं, तो it's a gravity based position. ठीक है, हमारा सब चीज like that's why I shared that alignment कि हम लोग का एक्सेस और प्लेन है. तो हम लोग जब लिखते हैं तो we keep a copy on the table, so we get the gravity support. But when it comes to the blackboard, it's the anti-gravity. So child need to develop the midline crossing with the anti-gravity positions too. Okay, so it helps with the body awareness. Okay, so like midline crossing, also the child needs to be aware with the like next point is body awareness. So they need to be so much oriented with their body. Like even if I close my eyes, so even if I know like this is my hand moving, my hand is moving on the right side, like I close my eyes and my hand is moving in the right side, my hand is moving on the left side, and my hand is moving straight, or I'm catching the ball straight. So this is where your midline orientation get mixed, and where your body awareness get integrated. So these all are very important before you develop their writing skills. ठीक है, उनके writing skills को improve करने के लिए before that you need to develop their bilateral like these midline crossing, body awareness. Now comes with the bilateral integration and sequencing. Like if you will try writing with the both hand, okay, अगर आप दोनों हाथ से लिखने का try कर रहे हैं, so you can use your copy and pen writing with the both hand, and you'll see that your right hand, if you're right-handed, your right hand handwriting is more darker than your left hand handwriting. Okay, so because I told about the gripping, about the tip, about the pressure, about the pull and push, okay, we do with the pen and the paper while writing. So it will come up with the darker with the right side. Okay, so we are able to move our hand with like that. Can you please show the video with the bilateral? Yeah. Okay, so this is a video. I made a child to trace the two lines with both the hands on the paper. So this shows the bilateral integration and sequencing, like how he needs to follow the pattern with the blocks while tracing, and how the child need to position their hand, how much the child is aware about what he is doing and where he need to place the block. Everything is there with the bilateral, and bilateral integration is the most important thing in our ADL, with also with the right-handed and with the left-handed. So next point, please. So bilateral integration also have few, like I should say, parameters which should be integrated as well, like symmetrical patterns. Now, what is the symmetrical patterns? So wearing a t-shirt, आप शर्ट पहनते हो या शर्ट पे से उतार रहे हो, so you use your both hand together while midline crossing. आप ऐसे तो it will be very difficult to take out your shirt, no? You always cross your hand and use both the hand to take off your shirts. या आपको अगर कोई और एक्टिविटी करनी है, so you take it out together. आपको alternate. Okay, so you use with the midline also. You go by the bilateral also to remove your shirt. Okay, so this is symmetrical pattern where both of your hands work together for a task or for doing an activity. It's a symmetrical pattern. Okay, okay. Now next is alternate pattern. Alternate patterns generally are when it goes by right or left. पहले आप right के, then left, then right, then left. Like making a sound with a drum beat, right, left. Okay, so these are the like playing something with right or left. Okay, or like playing any, playing any your musical instrument. These are your asymmetrical, where you alternative pattern. Yeah, and we when it goes to gross motor, always you will come up with when you climb a stair, which is a development of a children. You climb a stair, you climb alternatively. Okay, so this develops your climbing stairs with alternate legs. This develops by the age of 2 to 3 in a child. ठीक है, एंड जब तक नहीं होता है दे टेक सपोर्ट, और वो एक ही पैर एक ही सीढ़ी पे, फिर एक ही पैर, फिर एक स्टेयर पे, फिर एक पैर, फिर दूसरा पैर भी उसी स्टेयर पे. सो दे क्लाइम लाइक दैट. But what we do is we do alternatively. Okay, next come with the asymmetrical pattern. ठीक है, so tearing a tissue paper, like one hand is supported with the object and one hand you are using it. Okay, so आपने right hand से hold किया, you are tearing a paper with the left hand. This come with your asymmetrical pattern. Okay, same goes with the board. Okay, like if I am writing here, so I'll hold this copy and I'll start writing. ठीक है, तो एक हाथ support के लिए use हो रहा है and other hand is using to do the activity. Then it goes with the asymmetrical pattern. Okay, so even with the beads, हम beads लगाते, bidding a beads, that comes in the alternating pattern. Okay, I'm very thirsty and now I want to pour water. So what I'll do, I'll use one hand to lift it and one hand to pour. So these are few example of daily basis where we need to use this asymmetrical pattern. So these are the pattern we use every day. Okay, so these are the things which left-handed struggle, but always we have options. We have shared so many tips with them. So working on their bilateral and sequencing will help the left hand children to develop these all patterns, right? Okay, next please. Okay, coordination. So coordination is basically with your eye hand coordination. I would like to say if we are going to writing patterns, right? तो अगर हम एक left handed को coordination में help कर रहे हैं with all this midline crossing, body awareness, bilateral, so these are the steps. Always remember, आप कहीं से भी शुरू करेंगे तो you will end up wrong somewhere. Okay, so these are the steps we develop. So when it comes to eye hand coordination, if you will work on children eye hand coordination, so it will help even the left handed child to not to struggle with so many things, and they can develop a very good handwriting, a very good activity, finishing up a very good activity by the help of eye hand coordination. So if the child is copying it from the blackboard, अगर वो blackboard से कुछ, even though it will take eye hand coordination, right, आंखें देखेगी और हाथ लिखेगा, है ना? तो these are the very basic things, and which an OT can help your child, even if your child is normal. But few tips which I shared is for left-handed children, where a special educator and an autist can help. Okay, so basically, I would say that these are the things जहाँ पे हमको इंटर-रेफरली काम करना चाहिए. So these are basically with the special educators who will help your child कि writing में सबसे ज़्यादा help करें. So these are for all special educators, that अगर बच्चा struggle कर रहा है, तो even though you can develop these activity for them, and you can calm them down, and you can ask them कि write. Okay, so like midline crossing का सबसे अच्छा lazy 8 pattern है. So it will cross the midline. As much as big you will make, that will help your child for midline crossing. And that child, it will calm the child down. If it has so many, so many benefit, like वो memory में improvement लाता है. That will help your child with the emotion development. That will help your child with the coordination, bilateral. Yes. That will help your child for calm themselves down.
True,
so these are few points. जो lazy 8 pattern will always help.
Yes,
You
lazy
can
8
make your child
is definitely beautiful for everybody, for all age people.
Yeah.
So
Making,
Dr. Charu,
like I told that,
right?
yeah.
No,
So
go ahead,
that
go
is,
ahead.
yeah. So like even with your alignment, like I told, first I'll finish the lazy 8 pattern.
Dr.
Is
Charu,
the
sorry,
best.
sorry to just intervene in between. It's 7:04. We have exceeded
Okay.
the time of our webinar. So what we can do
Okay.
is, can you share your email ID in the chat for?
Yeah, I'll share it.
Yeah.
Right.
So participants, kindly make a note of Dr. Charu's email ID. When you email Dr. Charu, she can help you with whatever you might have questions to ask. You can always ask her. And Dr. Charu, before you continue, I would just like to give you a vote of thanks, because I thoroughly enjoyed your session. Like, there were so many takeaways that I am taking personally as a special educator. Grasp is something which, of course, everybody, I think for parents, it's a very good visual that you gave. But that pulling and pushing point that you did for the left hand right, like, I never thought about it, it never occurred to me. So it came beautifully, like, you really pull and then the left hand is push. Also, I would like you said, there is a gripper names for autism. Can you just write that in the chat for our parents and educators to know what are the grippers, so they know? And I have made a lot of notes actually, that I generally use start the writing by, making them write on a plain paper. But then when you said for left-hander, it is scientifically so correct.
Yeah.
So, yeah, thank you so much. Like, I was like, I wanted it to go for long. I thought 45 minutes मैंने बहुत कम रखा, हमें और रखना चाहिए था. There was so much to learn. So yeah, thank you.
Okay. These are the last few points. I'll continue and then we can stop it. Yeah. So like we have finished with the midline crossing, and then when you calm down the child and then you ask, so whatever the tips I gave, it will be most successful thing you can ever do with a child. Okay. So same with comes with the belly button. I'll just end up with this. So when you are aligned, you have axis and planes. So when you will press the belly button, it will help your child to think, and because it's connected directly midline with your brain, and it will help your child to think, like develop the thinking ability and developing the writing ability. So you can just press the belly button and you can place your one hand here in the clavicle and you can just move. This is the exercise which will calm your child down. It will allow your child to think. It will allow your child to coordinate. So this is the main, because our alignment end up here. at our belly button, and it divides our body with the body awareness. Okay. So thank you so much, everyone,
Thank you, Dr. Charu.
for attending the session. And like if we can take the questions, otherwise, like
Yeah, parents, you have questions, you can type it in the chat box, or it's okay if they can email you, right, Dr.
yeah,
Charu?
it's absolutely fine.
Okay, so we'll extend for 3 more minutes if anybody has any question, or else we will conclude our session.